If you have recently been told that your lymphoma has come back after treatment, I want you to pause for a moment before you assume the worst. One of the most difficult conversations I have with patients is when they hear the words, your lymphoma has relapsed. For many families, it immediately feels like the end of the road. But in 2026, that is often no longer true. In fact, some of the most exciting advances in cancer treatment are helping patients who previously had very limited options. Today, I want to explain one of those advances, that is CAR T-cell therapy, and why it has become one of the most important breakthroughs in modern hematology. I'm Dr. Ganesh Jaishetwar, consultant hematologist and bone marrow transplant specialist, and let's discuss this in simple language. First, let's understand the problem. Our immune system contains specialized cells called as T cells. Think of them as your body's security system. Their job is to identify threats and eliminate them. The challenge is that lymphoma cells are more smarter. Over time, they develop ways to hide from the immune system. Even though cancer is present, the body's natural defense system often fails to recognize effectively. This is where CAR T changes the game. Instead of giving another medicine that attacks the cancer from outside, we use patient's own immune cells. We collect T cells from the patient's blood through a process called as leukapheresis. These cells are then sent to a specialized laboratory. In the laboratory, scientists genetically modified these cells to recognize a specific marker present on lymphoma cells. The modified cells are multiplied into millions. Once ready, they are infused back to the patient. And now something remarkable happens. The same immune cells that previously could not recognize the cancer suddenly become highly trained cancer hunters. They actively seek out lymphoma cells and destroy them. This is why CAR T therapy is often described as a living drug and a living treatment. The therapy doesn't simply enter the body and disappear. The cells continue working inside the patient, identifying and attacking cancer cells. One question I frequently hear is, Doctor, who actually needs CAR T therapy? The answer is very important. Not every lymphoma patient requires CAR T. However, it can be extremely valuable option for selected patients whose disease has returned after treatment or has not responded adequately to conventional treatments. The decision depends on multiple factors, including type of the lymphoma, previous treatment, overall health of the patient, disease status, and several specialized investigations. That is why an expert evaluation is essential before deciding on the next steps. Another common question is about results. While every patient is different and no responsible doctor can promise outcomes, international studies and real-world experience has shown that CAR T therapy can achieve deep and durable remissions in many appropriately selected patients. This is why hematologists around the world consider it one of the most significant advances in blood cancer treatment over the last decade. Families also ask me about accessibility. A few years ago, many patients associated CAR T therapy with treatment available only in select international centers. Today, the landscape is rapidly changing. Advanced cellular therapies are increasingly available in India, allowing more patients to access world-class treatment closer to home. Now, I also want to be honest. CAR T therapy is a powerful treatment. Like every powerful treatment, it can have side effects and require careful monitoring by experienced teams. This is not a treatment that should be undertaken casually. It should be performed in centers with expertise in hematology, bone marrow transplant, and cellular therapy. The most important message I want you to remember today is this: lymphoma relapse is serious, but it is not the same thing as having no options. Medicine has evolved dramatically. Treatments that were considered impossible just a few years ago are now helping patients achieve outcomes we could only hope for in the past. If you or someone in your family has been diagnosed with relapsed lymphoma, don't make decisions based solely on fear or information found on the random internet searches. Get a proper expert opinion, understand all available treatment options, ask questions, review the science, and then make an informed decision, because sometimes the next chapter of treatment can look very different from the first. If you have questions about lymphoma, CAR-T therapy or blood cancer treatments, leave them in the comments below. I read them personally and will try to address them in future videos. Thank you for watching, and I wish you and your family the best of health. Thank you.